Artificial methods. 1. Oral contraceptives. These are hormone-containing medications that are taken by mouth to prevent pregnancy. They come in pockets of 21, 28, or 91 tablets to take by mouth once a day, every day or almost every day of a regular cycle. Health problems such as heart disease. Advantages. It can lessen the pain of menstrual cramps, keep acne under control, and protect against certain cancers. Disadvantages. It can cause headaches, nausea, breast tenderness, and mood swings. The possible effects or risks of using the pill is unintended pregnancy, blood clots, cholesterol levels, migraine headaches, cardiovascular disease, and cancer. 2. Transdermal patch. It adheres to the skin as a way to deliver drugs and acts as a carrier for a drug holding it until it's applied. Advantages. It offers smooth, continuous drug delivery, increased bioavailability, and reduced drug interactions. Disadvantages. It does not provide protection against sexually transmitted infections (STIs), including HIV. The possible side effects of transdermal patch are nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, dry mouth, or headache may occur. 3. Vaginal ring. It is a small soft plastic ring that you place inside your vagina. You can leave it in for 21 days, then remove it and have a 7-day ring-free break. You're protected against pregnancy during the ring-free break. After the 7-day break, you then put a new ring for another 21 days. Advantages. The ring may ease premenstrual symptoms and bleeding will probably be lighter and less painful. Disadvantages. Some women have temporary side effects including more vaginal discharge, breast tenderness, and headaches. Its risks include heart attack, stroke, blood clots, and liver tumors. In very rare cases, they can lead to death. 4. Subdermal implants. It involves the delivery of a steroid progestin from polymer capsules or rods placed under the skin. Advantages. It works for 3 years without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. Disadvantages. Your periods may be irregular or stop altogether. You may get acne or your acne might get worse. You'll need a small procedure to have it fitted and removed, and it doesn't protect you against sexually transmitted infections. Disadvantages. It may cause nausea, stomach cramping, bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation or discharge may occur. Pain, bruising, numbness, infection, and scarring may occur at the site where the rod is placed. 5. Hormonal injections. It is a shot of hormones that last 1, 2, or 3 months depending on its type. A doctor or nurse will inject it into the muscle tissue in your arm or bottom. Advantages. Each injection lasts for either 8 or 13 weeks. It's an option if you can't use estrogen-based contraception. You do not have to remember to take a pill every day. It's safe to use while you're breastfeeding. It's not affected by other medicines and it may reduce heavy, painful periods. Disadvantages. It does not protect you against STIs. Your periods may change and there can be a delay of up to 1 year before it returns to normal and you can become pregnant. Some people may put on weight when using it. You may experience side effects like headaches, acne, hair loss, and mood swings. There's a small risk of infection at the site of the injection. In very rare cases, some people may have an allergic reaction to the injection. It also affects your natural estrogen levels, which can cause thinning of the bones, but it does not increase your risk of breaking a bone. 6. Intrauterine device UDE. It is a small contraceptive device that is inserted into the uterus womb to prevent pregnancy by not allowing the sperm to fertilize the egg. It may also make it harder for a fertilized egg to implant in the uterus. Advantages. It protects against pregnancy for 5 or 10 years, depending on the type. Once an UDE is fitted, it works straight away. There are no hormonal side effects. It's safe to use an UDE if you're breastfeeding. It's possible to get pregnant as soon as the UDE is removed. Disadvantages. Your periods may become heavier, longer, or more painful, though this may improve after a few months. Most people who stop using an UDE do so because of vaginal bleeding and pain. Risks of the UD. It may cause pelvic infections and there's a very small chance of getting a pelvic infection in the first 20 days after the UD has been inserted. 7. Chemical barriers are sperm-killing substances, available as foams, creams, gels, films or suppositories, which are often used in female contraception in conjunction with mechanical barriers and other devices. Advantages. They are the only method that may protect against STIs such as HIV or AIDS and herpes. Barrier methods are safe to use while breastfeeding. It do not use hormones, so they are safe for women who smoke or who have health problems such as heart disease. Disadvantages. These methods do not prevent pregnancy as well as IUDs or hormonal forms of birth control. Barrier methods prevent pregnancy only if you use them every time you have sex. You may have to interrupt sex to use some barrier methods of birth control. It can increase the risk of getting HIV from an infected partner, may cause vaginal burning and irritation from the spermicide, and may increase the risk of urinary tract infection UTI. Diaphragm is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix, the entrance of your womb. You need to use it with a gel that kills spermicide. Advantages. You only need to use a diaphragm or cap when you want to have sex. You can put it in at a convenient time before having sex. There are usually no serious associated health risks or side effects. You're in control of your contraception. Disadvantages. It's not as effective as other types of contraception, and it depends on you remembering to use it and using it correctly. It does not provide reliable protection against STIs. It can take time to learn how to use it. Putting it in can interrupt sex. There are no health risks associated with using a contraceptive diaphragm or cap if you use it according to the instructions that come with it. 9. Cervical cap. It is a barrier contraception method. It's a soft rubber cap with a round rim that fits snugly around the cervix. It covers the cervix so sperm can't get in and fertilize an egg. Advantages. Unlike the diaphragm, the cervical cap protects against pregnancy for 2 days 48 hours and for multiple acts of intercourse within that time frame. When placed appropriately, the cervical cap is often not felt by either partner during sexual intercourse. Disadvantages. The cervical cap is more difficult for women to learn to insert and remove than the diaphragm. If worn for more than 2 days 48 hours, you run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Its risks include many times a day. It can irritate your vagina and increase your risk of HIV and other sexually transmitted infections. 10. Male condoms. It is worn on the penis. It is usually made of latex, a type of rubber. It works by keeping semen, the fluid that contains sperm, from entering the vagina. Advantages. When used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. You only need to use them when you have sex. In most cases, there are no medical side effects from using condoms. Disadvantages. It may split or tear if not used properly. Some people may be allergic to latex, plastic, or spermicides. When using a condom, you have to pull out after you have ejaculated and before your penis goes soft, holding the condom firmly in place. In most cases, there are no medical side effects from using condoms. 11. Female condoms are a barrier method of contraception worn inside the vagina. They prevent pregnancy by stopping sperm meeting an egg. Advantages. Female condoms help to protect both partners from STIs, including HIV. When used correctly, they're a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Disadvantages. Female condoms are very strong, but they may split or tear if used properly. They're not as widely available as male condoms and can be more expensive. Female condoms do not have any side effects except to individuals who are allergic to latex. 12. Surgical methods. Both men and women could be surgically operated on to prevent fertilization. For women, the process is called tubal ligation or tubectomy, and for men, it is called vasectomy. Advantages. It is very effective at preventing pregnancy and is considered as permanent method of contraception. Disadvantages. It requires surgery, usually under a general anesthetic, and does not protect against STIs, so you may need to use condoms. Its risks include, albeit low, surgical implications such as internal bleeding, infection, or damage to other organs. Natural methods. 1. Abstinence is simply not having sexual intercourse. It prevents pregnancy by not giving the opportunity for semen to enter the vagina. Advantages: it's free and endorsed by many religious groups. It's 100% effective in preventing pregnancy. No medical or hormonal side effects. It encourages you to build your relationship and express intimacy in other ways and protects you from sexually transmitted infections. Disadvantages: both you and your partner must be committed to not having intercourse. Pregnancy is still possible even without penetration if semen is on or near the vagina. Other sexual activity such as oral sex can expose you to STIs. Its possible effects include a higher risk of developing cardiovascular disease. 2. Calendar method. It helps you predict your fertile days by tracking the length of your menstrual cycles over several months, which allow women to avoid sexual intercourse or use alternative contraceptive methods during the fertile stages of their menstrual cycle. Advantages: they are natural and do not cause side effects. They do not require any special devices or procedures and do not cost anything. And women become more knowledgeable about their menstrual cycle when they use the method. Disadvantages: women must monitor the length of their menstrual cycle in order to use them effectively. It is only suitable for women who have regular menstrual cycles. It may be difficult for some women, and they do not protect against sexually transmitted infections (STIs). Using of calendar method as a form of birth control doesn't pose any direct risks. 3. Basal body temperature method. It is a method of natural family planning that requires only the purchase of a very accurate thermometer. The method, which calls for tracking the woman's body temperature on a daily basis, helps to determine which days of the month she is fertile. Advantage: it helps you gauge the best days to have or avoid unprotected sex. Disadvantages: the basal body temperature method may not accurately predict ovulation in all women, including those with irregular menstrual cycles. It offers no protection from sexually transmitted diseases. This method has no side effects. The only cost is the price of the thermometer. 4. Cervical mucus method. It is a way of keeping track of your vaginal discharge, or cervical mucus, every day. Advantage: this method is good for determining when you're fertile by using your vaginal discharge as a way to determine where you are in your cycle. Disadvantage: this method is not always easy to learn without the guidance of your OB or GYN or doctor. Using the cervical mucus method to promote fertility doesn't pose any risks. 5. Symptothermal method. It is a fertility awareness method used to predict when a woman might be fertile. Advantage: it combines the calendar, cervical mucus, and temperature methods. Disadvantage: this method shares the same disadvantages that each of these techniques has individually. The main risks associated with this contraceptive methods is the failure to prevent conception due to errors in instructions. 6. Ovulation detection. It is used by women. The test kits most often come with 5 to 7 sticks. You may need to test for several days to detect a surge in LH. Advantage: fertility awareness helps women and men better understand when the fertile period is, how contraceptives affect menstrual cycles, and ovulation. Disadvantage: they can be difficult to read. 7. Coitus interruptus. It is also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Advantages: it does not affect breastfeeding, no economic cost and use of chemicals. Disadvantage: it does not protect against sexually transmitted diseases (STDs), including human immunodeficiency virus (HIV). It has no directly associated health risks.